Welcome, everybody, to our second episode of our podcast, Mind Matters. My name is Tanuj Sharma, and I'm the co founder and CEO of Kana Health. Kana is our platform, which is sole aim is to transform therapists into super therapists by making sure that they have the latest and the greatest of AI tools for personalized treatment recommendation and better clinical decision support mechanism. Today's episode is made for therapists because we wanted to specifically dive into a very important topic, which is core to almost every therapist practice. How do you navigate the ever evolving landscape of client enrollments, diagnosis, and treatment planning? And as we all know, starting therapy can be a very complex process, both for new customers, new clients, new patients, as well as for the therapists who are guiding them through those initial steps. We'll delve into some of those details, the typical onboarding process, uncover the areas which could use improvements, discuss the changes that could streamline this journey. And to talk about it all, we have a very special guest, the incredible Nidhi Kaul. Nidhi, welcome. Your intro, please.
Yeah, thank you, Tanuj. I'm excited to be here and to have this conversation with you and to learn how Kana can be helpful to us.
Thank you, Nidhi. Really appreciate that. So to kick off the conversation, Nidhi, you want to talk to our audience about how does someone, when a new client comes in, how do they get started with therapy? What does a typical process look like, for welcoming the new clients, making them familiar with the therapy practices?
Sure. Tanuj, there's really two main ways that clients get connected with a therapist. One is that they determine on their own that they're experiencing mental health symptoms. And so they may say, I'm experiencing a lot of distress. It's time for me to get some services. And they'll look online for a therapist, or they'll ask around in their network who to connect with. The other way is a client might actually go to their medical provider, and just in a conversation with them at a physical or in some other kind of consultation, they may share some symptoms, and the medical professional may refer them to a therapist. At times, the client has options and choices, like I said, where if they determine on their own, they may go online and find a therapist that fits their needs. At times, they may not actually get much of a choice, and they may just be connected with a provider in their network through their insurance, through the healthcare system that they're accessing. So I will say the process can really look different based on the payer, based on the system, the healthcare that they're part of, based on what resources are available to the client and level of awareness. And again, that also determines how that first point of contact happens. So in private practice, which is what I have, I usually get a phone call from a client or a email from a client as the first point of contact. And then we schedule a complimentary session. And this is really, really important part of the process, Tanuj, that a therapist can connect with the client before we even have an intake session in this informal way to figure out what are the client's goals, what are they looking for from a provider, share a little bit about our experience, our approach. It's an opportunity for the client to see, does this person seem like the right fit for me? Which I think we'll talk about a little bit more later on, is a really important part of the process, is how much the client feels connected with the therapist. So usually, in that complimentary call, we'll have a question about goals, approaches, experiences, and then we schedule an intake session. So that's a little bit of the process. Now, again, as I mentioned, not everybody gets to have that. In certain healthcare systems, you don't even necessarily talk to the therapist before you have that intake session. So you meet the therapist for the first time in an intake session, and then hopefully it works. Sometimes it doesn't, and then you kind of shopping around for therapists.
So it's fair to say that this is probably the most vulnerable time for a client who's specifically coming in for a therapy session for the first time in their life. And, they don't even know what to expect from a therapy session. And that is why that the formation of that bond between therapist and the client is so much more critical at this point of time.
Absolutely. And even if they're coming for the second or third time, if they're meeting you as a provider for the first time, it's still extremely vulnerable and challenging, because they're also determining, do I open up to this person? I don't know if we're going to continue treatment with them. Are they really the right person to be able to help me? Do I feel like they understand me? And on a therapist perspective, we're also trying to gauge, are we experienced enough? Do we have the right approach to be able to serve this client in the way that they're looking for? So it goes
Yeah.
both ways.
So it is fitment both ways, whether you're the right therapist for that client or whether that client is right for you. And what I understood from you, and which is probably a piece of wisdom for all therapists who are listening to our podcast today, is that initial session, which could be complimentary, 15 minutes, 30 minutes, is very important for you to evaluate and measure that fitment.
Absolutely. Absolutely. I find it to be invaluable, and I know not everybody provides it, but I would rather spend those 15, 20 minutes having that conversation instead of starting a few sessions with the client and then leaving them feeling unsettled because I wasn't the right fit. It's
Yeah.
not fulfilling for myself either as a provider, knowing that I'm not giving them what they need. So it's better to figure that out right at the get-go.
And plus, it's so much more harder for the client who's trying to get help, right? And from your perspective, Nidhi, are there any part of this initial onboarding process, which is kind of due for, some sort of a change or some things could be done better, whether it's supported by the systems or the platforms which we use for onboarding today?
Yeah. So as I mentioned, we have that first complimentary conversation, but then after that, we schedule an intake session. Before that intake session, whether it happens virtually or whether it happens in the waiting room, a client will fill out some intake paperwork.
Mm-hmm.
And that is not streamlined. Based on the system that the client is seeking services from, there's going to, my private practice may have a different intake form than Kaiser Permanente does, than maybe a group practice therapy does. So each intake process can look so different in terms of the forms you have to complete, in terms of the questions that you're being asked. So in terms of improving the onboarding process, I think a little bit more handholding while people are filling out even those forms can be helpful so that they understand what is the purpose of the data that's being collected. They understand what are really the questions that are being asked. For example, in my practice, I administer the PHQ-9 and the GAD, which is these scales for anxiety and for depression.
Mm-hmm.
And gosh, so many times I ask the clients in the session, hey, this is what I observe that you've completed on the forms. Is this accurate? And as we explore it, it's often inaccurate because clients don't read the part where it says, in the last 2 weeks, how often have you experienced these symptoms? What they're doing is they're filling it out for what they're feeling in the moment. So the moment they're feeling really anxious, stressed, angry, and so everything is a higher level of distress. So even in terms of explaining to them what the process looks like, explaining to them how the data is used, explaining to them how to complete those forms can be helpful later on as we're building a relationship and treatment planning and understanding what the client needs.
No, that's spot on, Nidhi, and that is the core design principle of our platform as well, Kana, right? And we tend to engage with the clients right from their day one of that referral call, so that by the time you meet with the therapist, we have understood and collected enough data points so that your self-reported symptoms are much more accurate, and you're not just talking about those symptoms at that point in time. It has a little bit of a trajectory and history over a period of time, so that data gives you the right level of insights in terms of understanding the symptom profile and risk profile, and finally arriving at the diagnosis of that patient. That's very valuable, Nidhi. Thank you so much. And talking about how do you go about the determination of the diagnosis? From provisional diagnosis to a confirmed diagnosis, and then subsequently creating a treatment plan.
So it can take a couple of sessions to determine what's really going on with a client. Are they meeting criteria for a diagnosis? Are they not meeting criteria for a diagnosis? Usually what happens is, we look at the data, we look at the forms that clients complete. In the interview, in the conversations that we have with clients, we ask a lot of follow-up questions about sleep and energy and performance in daily life. So really trying to have a conversation with the client to understand what are their symptoms, how is it impacting their daily functioning? And based on that, we try to see, does this person meet criteria for a mental health disorder? And then based on the diagnosis, as well as primarily the symptoms, Tanuj, the treatment plan is created. So I will say at times, you might have a client who's experiencing depression and they're experiencing substance use problems. And as a clinician, my inclination would be to start working on the substance use, right? When we're talking about treatment planning, that you set goals, but you have to meet the client where they're at. So there are times when clients are like, I don't want to stop using my marijuana, I want to continue using it. And so what we work on then is figuring out what are the goals that make sense for this client. At the initial phase, and then in every session thereon, there's a review of what are the goals that the client has, and now what are the approaches that would be evidence-based, that would treat those specific goals, whether it's sleep, substance use, relational distress, depression, anxiety, whatever it is that they're hoping to reduce the symptoms of.
So is it fair to say, Nidhi, based on what I just heard, that there is a variability in conclusion of diagnosis and defining the treatment plan? One, because there are so few evidence-based programs or treatment techniques which have been published formally. And second, the diagnosis and the symptom itself evolve over a period of time because the client's condition also changes over a period of time. Is that a correct statement, Nidhi?
Absolutely. Yeah, because as I said, what may be a priority in one session may change the next time that you meet with a client. And yeah, there is a variability because my experience working at Kaiser Permanente for almost a decade informs how I approach clients now. It informs the way that I envision diagnosing and treatment planning. If there's another provider who had training and experience in a different setting, they will be by that. Their approach will be informed by that. The way that they view symptoms will be impacted by that experience. So there is absolutely a variability. And there are times where then we need to consult with each other to understand, hey, this is what I think is happening. What would you diagnose? How would you approach this client? How would you really serve them? And you will find that providers will say, oh, I would have done this versus this. There may be slight variability there.
So basically you're tapping into your peers because they have slightly different practice, different therapeutic framework, and you want to explore whether, some other technique or a therapeutic framework could have been better for this patient. And, they would have shown better, outcomes in terms of the treatment plan, which they were put on.
Exactly.
Right?
Exactly.
Yeah. And, that is one of the intent of our platform as well. We look at real world evidence. We look at evidence-based practices and programs which have been cleared by clearinghouse, engines as well. And we make those near real-time recommendations to the therapist that, you may have certain therapeutic experience or, your work experience because of the kind of med school you went to, the kind of clinical chain you're part of, the kind of healthcare system you're part of. But there are other treatment options as well, which could be equally as effective. And, you might want to explore this second treatment option, a third treatment option, which could be equally effective for this patient, of this social economic background, this ethnicity, and this, specific condition in terms of symptoms and diagnosis. And that is the intent of, Kana working behind the scenes to give almost near real-time second opinion so that now you're not dependent on just reaching out within your network and, asking your friends, hey, what would you do in this kind of a scenario?
Yeah. And I think that would be so helpful to therapists because, even relying on each other, I'm only getting, if I'm talking to one person, I'm only getting their experience and their background and their training. And mind you, we're constantly going for trainings and trying to update our knowledge and our experience. And it's not all specific to whatever context we worked in before. But even then, as you said, it's in the moment when you're working with a client and you're really in it. Some of it is just based on what instinctually you feel the most comfortably trained in that you can use as an approach. Whereas if we have something that we can partner with where we get some other suggestions, some other ideas, I think every therapist would be so happy to have a partner through the process.
Yeah, absolutely, Nidhi. And, thinking about the treatment plans, is it fair to say that all therapists should stay flexible when they think of treatment plans because, the client's needs, symptoms, diagnosis will change over a period of time?
Yeah, absolutely. Yeah. As I said, in one session, my client might be talking about how depressed they're feeling. In another session, it may be some relational issues that are coming up or performance at work issues that are coming up.
Hmm.
So, in every session, part of the process is assessing and understanding the client and trying to meet them where they're at. And that informs the approach that we're going to use in real time because if my client right now does not want to talk about how sad they are, they want to talk about something else, we have to be ready and flexible. So, treatment planning, treatment approach, that is constantly evolving based on our clients' needs, their priorities, what would best serve them at that time.
Understood. And Nidhi, like, in physical health, if you take a painkiller, you'll know in 30 to 60 minutes whether painkiller is working or not, whether you feel better or not. But how do you arrive that very objectively when it comes to, making, a determination whether your client is feeling better now and they're ready to be discharged? Talk us through your experience about that.
Yeah, and this applies even to assessing the treatment plan, its effectiveness, and reprioritizing goals and needs, as well as to discharge planning. We go off of conversations, of course, what the client is sharing with us on a weekly, biweekly, however, whatever the cadence is, kind of really just assessing their verbal and nonverbal cues. So whatever's observational. But then there's the other element of looking at the data that we're collecting. So as I mentioned, for myself, it may be the depression scale, the anxiety scale, noticing is the distress going down? Is it going up? What is actually shifting? Which, as I mentioned, will inform what we're going to be talking about in that session. So for example, if my client's goal was to increase their confidence, but I see in the last 2 weeks they've been having significant sleep issues, based on the data that they completed on the form, that our conversation is going to start there to explore what's going on based on what they've completed in those forms. So a part of assessment and treatment planning happens in the session itself. A part of it comes from the asynchronous forms that they complete in their own time. And when we're talking about discharge planning, it goes back to reviewing all of that, reviewing the conversations that we've been having, how the client's been evolving in terms of engaging in the skills, practice, their distress level, their performance and daily function, the forms that they're completing. All of that is assessed to determine whether a client's ready for discharge. And I'll add one other element to it, Tanuj, that I think is really essential to the discharge process, which is efficacy. Meaning, does the client feel ready for discharge? I might feel that they're ready for discharge. I might just look at the forms, think about our conversations, but does the client feel confident to be stopping therapy? So all of that is necessary when we're considering discharge from therapy.
No, absolutely. And, as I've learned from you only, Nidhi, that the end goal of therapy is to make clients self-sustained so that, when they feel these emotions the next time, they know how to respond, they know how to structure their thoughts. They're more self-reliant than, just relying on, either a therapist or somebody else, right? And in terms of determining whether a client is ready to be discharged, I believe, being a technologist, that is a role or a job to be done by, artificial intelligence as well, because that is the role technology should play in measuring and making sure that the data points which you're collecting from this client or patient are giving you the right trending signals that this client is ready in terms of self-reliance. Right. And that is the core design principle of our Kana as a platform as well, because explainability behind every single recommendation we make, whether it's a recommendation for symptom or recommendation for diagnosis or recommendation for treatment planning, we have to explain the logic of how did we arrive at a certain, conclusion. And before we make that, as a recommendation to the therapist, it has to be explained, which is probably, the role or a job to be done by artificial intelligence and technology, specifically in mental health space. So really the last question, Nidhi, but please,
Yeah, I just want to add that, you're absolutely right. That tool would be useful for clinicians, because if you're partnering with us and you're letting us know, like, hey, this is what the treatment approach could be, this is what we believe the diagnosis could be, even for us to be able to share that with a client, we want to have some evidence, some backing, some explainability, as you called it, to be able to share with the client, and for us to feel conviction that this does make sense for us to maybe pivot in our treatment approach. I also think this would be helpful when I was talking about client readiness to discharge from therapy. If we have the data, as you mentioned, Kana is collecting data about sleep and mood logs and all of this information. If I'm able to access that and share that with my client, that, hey, look, this is why I feel like you're ready to discharge from therapy, because look at your own scores. Look at how sleep has changed. Look at how your thoughts are so different from what they were before based on what you are logging. Versus me telling them this is what I've been hearing, they can actually say, hey, yeah, you know what? I see the change in the way that I'm narrating my story and what I'm thinking and feeling. And so I think that could be super valuable as a tool to use to help clients understand also that they're doing better and what they're doing better in.
No, I 100% agree. I think there is only so much you can report on a piece of paper versus collecting the data 24/7, right? In terms of the science of improvement, science of keeping up with your own commitment in your own well-being, right? Okay, so really the last question for our audience today, Nidhi, if you were to share any pearls of wisdom for therapists who are developing their career or established in their career, any final message for our therapists who are listening today?
Sure. One is that I think lean into technology, lean into using what is available as a resource to augment the treatment that you're providing to clients. I think as therapists, we're often very scared of technology. I can't speak to everyone, but I know that a lot of us are like hesitant to try to use technology. And yet I find that there's meditations, there's self-care practices that are available online that we can suggest to our clients. And as you're mentioning with Kana, there's just so much that could be valuable to our approach as clinicians that could actually build our confidence when we're providing services to our clients. So I would say lean into technology. Don't be afraid of it. Really explore it to augment services. And the other thing I really think is important is focus on building that alliance. As I said, that complimentary session at the beginning, or sometimes you don't have the ability to give that because of the healthcare system that you're working under, but just focus on building that alliance, listening carefully, attentively, understanding what your client needs and wants from you. That has to inform your treatment plan and your approach, and that is going to affect the outcome.
No, those are golden words, Nidhi. The bond between the therapist and the clients, it can never be replaced, right? And no matter how many reports you would read about artificial intelligence trying to make claims of, how can you put a therapist in an app? It's just not possible. And being a technologist myself, 23 years, I believe, the AI has a role to play. AI is here to make therapists into super therapists, right? And you guys are superheroes. And think of AI as your sidekick, which is going to help you turbocharge your practice. Is going to help you deliver that personalized treatment. Well, thank you so much, Nidhi, for your time today. Really, really appreciate it. And to our listeners, we hope you found this conversation insightful. If you're a therapist looking to transform your practice, stay tuned to see how Kana Health can be part of your journey. And thanks, everybody, for joining in today. See you until next time. Thanks. Thanks, everyone. Thank you, Nidhi. Pleasure.